My name is JD. I'm 38 years old, and I'm from Thomaston, Georgia, and I have this bubble on my ear.
He's got a scrotum on his ear.
It's the size of a pear, and it's shaped like a pear. It goes like from skin to the end, fat at the end of it.
Now this looks really unusual. My first thought when you have something that huge hanging from an earlobe is that it's a keloid. But keloids are typically firm nodules that don't just hang like that. I'll be very interested to learn a little bit more about what happened here.
I saw a doctor when I was like 17, and he said, well, it's just hard tissue in there. It'll probably soon either fall off or it'll shrink.
What kind of doctor did he see? Dr. Evil?
Mr. Evil.
Dr. Evil. I didn't spend 6 years in evil medical school to be called Mr. Thank you very much.
So this doctor told him that it will either fall off on its own or it will shrink on its own. That is really weird advice. I wonder what type of doctor he saw. It's kind of like a bag with a drawstring where it's very narrow at the top and it gets bigger at the bottom. Technically, he could tie a string around it real tight, cut off the blood supply, and eventually that mass could actually fall off. But I don't recommend doing that. You gotta see a doctor instead.
Sometimes it'll give off an odor, like if I'm sweating, so therefore I gotta keep it washed because it gives off a bad smell.
When things give off a bad smell, the first thing I think about is infection. If there is a superficial infection of a part of the body like this, it can secrete pus, which typically does smell really bad. But it's also possible that in the crevices of this mass that he's getting some just normal bacterial growth, like from sweat, and that could also smell not so good too.
With this bubble on my ear, it's taking me away from a lot of stuff with my family. It feel like you're less than a person, like you're not fit to be on this earth.
I hope somebody didn't actually try to make him feel this way, that just because he's got this mass hanging from his ear, that he's not fit to be on this earth. Like, that is absolutely insane. Now, one question that always enters my mind whenever I see somebody with a pretty obvious kind of cosmetic issue like this is, why didn't this person get it treated earlier? And we'll see whether we find the answer to that on this show.
John is avoiding getting married with the bubble on his ear because he feel like we are the beauty and the beast.
Oh, that's so harsh. I mean, they're both good-looking people. Beauty and the Beast, come on. I really hope that he can get this taken care of. So let's see what happens when Dr. Sandra Lee, aka Dr. Pimple Popper, comes into the picture.
Welcome, JD, right?
Yes, ma'am.
You have a growth hanging from your ear here,
Yes,
I see.
So as you can see, this was probably during the time of COVID because they're outside. I mean, I'm sure Dr. Lee sees most of her patients inside in an office, but in this situation, when you're worried about COVID, what can you do? Thank God that things have settled themselves out and we're not having to see our patients outside anymore.
It formed in the front, like a little bubble in the front, and then it formed in the back.
And the front and the back of your earlobe, kind of where the ear piercing was?
Yeah.
So that makes it sound like he has a large keloid. Now, keloids are basically overgrowth of scar tissue that can occur anytime you get a scar on the body. There are certain parts of the body that are higher risk for keloids, and the ears, especially the earlobes, are one of those areas. We do see it more commonly in people who have darker skin than in people who have lighter skin as well. Some other parts of the body that are higher risk for keloids is the sternum, the chest area, and any areas that have tension like areas of joints, like the shoulders and the knees. Two parts of the body that we almost never see keloids are the eyelids and the private area.
The main thing I worry about is it coming back? And that can happen with any keloid.
That's the main problem that we have when we take out keloids. It's not often all that difficult to actually cut a keloid out. The problem is that keloids come back, and sometimes they come back much, much bigger than they were before. The risk of a keloid coming back really varies according to studies, anywhere from 20 or 30% risk up to 70 or 80%. Did you know that you can look upwards of 5 years younger in just 2 minutes a day? You don't need to put a ton of products on your skin to look and feel amazing. The Youn Beauty 2 Minutes 5 Years Younger Skincare Bundle is perfect for the busy person who wants glowing skin with the least amount of work. I put these 4 products together just for you. They're made with natural and organic ingredients, great for all skin types, and perfect for all genders. Check out the Youn Beauty 2 Minutes 5 Years Younger Skincare Bundle at younbeauty.com and get over $30 off the individual product price. I guarantee you'll love these products or your money back.
Okay.
That is ready.
I tell you, it is so satisfying to cut something like that off, especially in this situation where I mentioned earlier that the keloid, that mass, is bigger on the bottom and thinner up top. And so it's not all that difficult just to cut it right off, to lop it off. The challenge comes is trying to make what's left look like a natural ear, and then how do you prevent that keloid from coming back?
Thankfully, JD's keloid is pedunculated, so it was not that difficult to remove.
You can see it just sitting there on the table, and I know you're thinking, how would it feel if I put that in my hands and tried to squeeze it? Well, the best way to describe a keloid like this is it feels rubbery. It's firm, but not too hard. So what can he do to help prevent the keloid from coming back? Well, one of the things that can definitely help are pressure earrings. There are earrings specially made for people who've had keloids. And you put these earrings on and they put pressure on where that previous scar was. We do know that having pressure over a scar can help prevent the keloid from coming back.
However, now is the complex part. Now is the part where I want to really reconstruct very carefully this earlobe so that it looks as normal as possible.
One key to reconstructing an earlobe like this is to leave enough tissue behind so that you have enough tissue to recreate it. A beginner's error would be to cut too much tissue off, not leaving you enough skin to create a nice contour to his new earlobe. Now, the good thing with the earlobes is that the earlobes are the one part of the ear that does not contain cartilage. It's just really skin and fat. And so reconstructing an earlobe, if you have enough tissue, is actually not all that difficult of a surgery. I actually do it quite often, especially when you have patients who've had gauged earrings where the earlobes have been completely stretched out.
Hopefully I'll make you happy because you're gonna see the difference there. It's just the stitches, those come out and then you won't have those little indentations there. So it should flatten down.
Well, nice job by Dr. Lee. This is a really challenging thing because the earlobe itself, if you ever look at somebody's earlobe, but mine's not a great example because mine is attached, but earlobes are very smooth, and therein lies the challenge. You want to try to create as smooth of a contour as possible, and when you've got such a dangly mass, and especially in his case, when you've got that keloid tissue, which is really thick, it can be very, very difficult to recreate the perfectly round contour of a normal earlobe.
It's been 3 months since I seen Dr. Lee. Everything has changed in my life. When I used to get ready, I had to sit there and wash it and get, like a certain smell to it. But like now, I don't even have to worry about it.
Fantastic job by Dr. Lee. His earlobe looks great, and I'm sure it's made a huge difference in his life. So this gentleman had a mass hanging from his ear that was a keloid. Can you imagine something literally 10 times that size hanging from the end of your nose? Well, this is something that Dr. Lee did team up with some facial plastic surgeons to treat on a guy who had massive rhinophyma. And this is overgrowth of the sebaceous glands of the nose to the point where he had a huge mass that covered his mouth and his chin. Take a peek at this video right up here. It is going to absolutely astound you. And the transformation is just absolutely unbelievable. And remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.